current guidelines only recommend endovascular treatment for large vessel occlusion. Having said that, amongst the physicians and the interventionists, there is not much equipoise for proximal M2 occlusions, and there is enough data published in literature that we do end up treating proximal M2 occlusions endovascularly, especially if they have disabling deficits. Apart from that, the guidelines do not recommend endovascular treatment for distal M2s, A2s, or P2s or P2 occlusions. We have the ESCAPE-MeVO trial, which is ongoing, as well as the DISTAL trial. So ESCAPE-MeVO is out of Calgary with multiple sites across the world. Similarly, DISTAL is a trial out of Switzerland with multiple sites across the world, and they're trying to randomize patients with medium vessel occlusion into standard of care or endovascular treatment arm. And this is the data from this is potentially going to help change guidelines. I think the biggest challenge for treating medium vessel occlusions or randomizing patients in trials with medium vessel occlusion is if you have the equipoise or not. So these trials do include proximal M2 occlusions. And I said, as before, that, many people just go and treat these proximal M2s. So it might be a challenge to enroll these patients in a clinical trial where there is a 50-50 chance that they might be in the control arm. So that is one big challenge. Having said that, there is also this concept of primary MeVOs versus secondary MeVOs. And primary MeVOs is, when we see that the occlusion on a CTA is in one of the medium vessel occlusions, and secondary MeVOs are something which can be out of because of the intervention, or it could just be that the clot migrated. One challenge in medium vessel occlusion is also because these patients have relatively minor deficits. So what would be a good primary outcome? Is it MRS 0 to 1? Is it MRS 0 to 2? And how much difference or what effect size would be sufficient to call it significant enough to change guidelines? So those are the challenges that are anticipated